we are talking about the Housing Surge and Shelter Stabilization Initiative, where our focus, as we'll just keep repeating it, our focus is on individuals over the age of 25 with no children in physical custody, i.e. single adults. And our intent is to reduce the shelter demand and increase housing. We did a slide this time about the HUD designated continuum of care, as the Anchorage Coalition to End Homelessness is Anchorage's designated HUD continuum of care. Just to go a little bit further, and I hate reading from slides because you can all read, but I'll just sum it up, that the coalition is here to help organize and deliver housing and services to meet the specific needs of people experiencing homelessness as they move to stable housing and maximize self-sufficiency. This usually and should include an action plan to address homelessness and prevent a return of homelessness. HUD states there's 4 parts, and I'm not going to go in depth, but briefly, it's outreach, intake, and assessment, emergency shelter, transitional housing, and permanent supportive housing. When I was looking at this slide, I really wanted to talk about how we, our partners in our community, we are already doing this. And so that makes me really happy that we are on the path, but today's presentation is going to tell you that we do need more. As required with our contract, bringing you the data, and of course, I will remind you that I love data, so I'm happy to bring this to you. I do have an update as the meeting was postponed from last week. I did not have the numbers for December, but I do now. And so that number for the first line of total adults over the age of 25 experiencing homelessness in need of housing and supports, that number for December would be 2,078. Just a reminder, these are folks that were touched by the system, not necessarily in shelter. Also, to go down the line, the 140, those that kind of been reached by street outreach. As you can see, that is a significant decrease, but that decrease happened because there was a lot of COVID exposures, staff shortages, of course, a holiday. And if you're not in the know, we are currently participating in the pick count right now this week. So we are hoping next month to come to you with higher numbers in this section. And then lastly, a success, in my opinion, is that we have increased the total number of folks housed in December to 25. The Landlord Housing Partnership, which I will talk about later with United Way, has been conducting weekly meetings with CSS's, Catholic Social Services, ICM team, and Intensive Case Management team. I know all of the acronyms. I'm not sure if everyone does, so excuse me as I slow down for everybody else. But they have been meeting weekly, and that has actually really been helpful to matching landlords with those that are experiencing homelessness. And I will speak more on that program later on. Of course, if you want to see the data and play by yourself, the website is on the bottom of this slide. This is our current shelter capacity for single adults. This is how we know it as of today. I really like the snapshot. What is the coalition prioritizing? So these are the things that we are prioritizing right now. There's a lot of things on this list. Briefly, we are participating in the facilitation group. We are designing and implementing the Sockeye, implementing the Barrett, of course, working with the Landlord Housing Partnership with United Way, partnering with the experts at the ADRC, which is the Anchorage Disability Resource Center, to assist those that might need personal care services or assisted living home, deploying AHFC's EHV vouchers, which is emergency housing vouchers that are good for 9 years. That's a very long time for housing stability, designing the rental and housing stability program for AHFC to administer, leveraging all the HUD, state, and municipal and philanthropic dollars that we can, focusing on coordinated entry for that prioritization to placement for those that have been in homelessness the longest, so our chronic homeless folks, and supporting our ongoing and future permanent supportive housing projects. But of course, my favorite, ensuring data completeness. If you don't know anything by the time I leave here, is that I like data. We have the same bottlenecks and challenges. We do have a new one, and that is just working with HD to identify resources that can be leveraged to support the facilitated exit strategy. So that's HUD funding, alcohol tax, AHD operating dollars. This is an ongoing conversation that we are happy to continue with AHD, and we are looking forward to meetings to make sure that next month we can bring to you some of those HUD funding or those funding streams that we can leverage. Again, the same bottlenecks and challenges that we've had before. One of the new ones here that I thought was interesting is that some of the assisted living homes are not accepting clients without approved Medicaid waivers. So that is a stumbling block for us. But again, our help and experts at ADRC are really helping us navigate that situation also. This slide is just simply a reminder of our gaps analysis, which was pre-COVID, but the solution to homelessness is housing. And we're just going to keep saying that over and over as the coalition. A lot of folks ask me, well, what kind of funding is there for rental assistance? And I really like this slide because it tells you how much money we really have in our community, and that the funding for rental assistance is not the issue, it is the lack of available units. I spoke briefly before about the United Way Landlord Housing Partnership, who's doing amazing work. They're actually doing weekly Zoom meetings to inform landlords of this program. They're doing another one today at 12 o'clock and every Wednesday at 12. I will put in the chat later how to reach them, but it's landlordhousingpartnership@gmail.com. As you can see in bold on this slide, they have increased their incentives, and I did a little snafu. I reversed the amount. So really it's $1,000 at lease up, and then $500 for tenant retention. And then if someone has a past sexual offense or past drug related offense, landlords can actually receive $1,500 at lease up, and then $1,000 at 6 months for tenant retention. United Way is definitely wanting to ensure that folks remain stably housed. And so increasing this incentive we're hoping will impact those that are experiencing homelessness. And then they also increased their risk mitigation fund to $2,500 maximum. These incentive payments can also be in addition to other funding streams. So like if someone has an emergency housing voucher, they can also tap into the rental incentives, which should hopefully increase them to be successfully housed. So we're hoping to layer. This slide is a more thorough look at the sockeye. I know there's been a lot of conversation. There has been 150 or more individuals identified needing this shelter. And so it coming online where they have a choice to stay there, where they can be in a placement for 6 to 18 months, get the care that they need, those personal care attendant services, where they can have the ongoing case management and work on permanent living situations is going to be enormous for our community. Also work on going to assisted living homes if that's exactly what they want to do. This program is underway, being designed with our partnership with Catholic Social Services, Agnew Beck, Rasmussen, the Alaska Mental Health Trust Authority. Not sure, and as I was doing the slides, I was like, Sala Remote Medics has been doing an amazing job, and it ties into the sockeye of showing the need in our community for the shelter like the sockeye, which will be the sockeye. So Sala, this is a snapshot of the day. They're currently providing services at the Aviator, the Alex, and the Guest House. In one day, I just picked a random day, they had 346 residents that were screened, including going door to door at those locations. Of those 346 folks, there were 5 folks that were assisted in non-emergent transport to the hospital. Their services include responding to incidents like shortness of breath, care coordination, wound care. They pick up medications. They provide medical equipment such as wheelchairs and crutches. These are people experiencing homelessness that might not be able to go to the doctor, don't have a primary care physician, have apprehensions about getting medical care, because Sala has built those relationships, has been on the ground every single day. Again, if you're looking at the number of 346 and realizing the sockeye is only going to house the 150, then truly this is a reality that there is a need for more services like this in our community, but that the sockeye is a great start. The other thing is, if Sala didn't do this work, that our hospitals would be more taxed to fill this gap. So this is really a slide of a kudos for Sala and their wonderful assistance in our shelter system. These squares here are what ACEH envisions after the mass care closure. So this is the housing and shelter navigation and residential treatment that we believe should be online, hopefully in June. And as a reminder that this mass care exit strategy implementation plan implementation strategy, it is not an alteration to our homeless prevention response system or the community's plan. This is a way to expand and use all of our many resources at this time to make sure persons experiencing homelessness are connected to services and become housed. We cannot do this work without you. If you've heard me speak before, I really like the domino effect. I like playing dominoes in my off time. And so without each person that does to engage, respond, partner, interact, reciprocate, we cannot continue. The next domino does not fall. So we understand this. We look forward to partnering with any and everyone, and hopefully more to come on that.